What I'm going to be presenting today is on oral submucous fibrosis. We're going to talk about different aspects of oral submucous fibrosis, which is a potentially malignant disorder. I shall very briefly talk about the disease itself and how important it is from a public health point of view and from the point of managing oral cancer. It's so important that we have a separate section in the 2022 WHO classification for oral submucous fibrosis. I shall briefly talk about the cause, which is the habitual use of Ricanat. I shall touch upon the clinical and the histological features. Talk very briefly about the pathways in the pathogenesis of this condition. This is very unique in that this is slightly different from the pathway of tobacco-induced potentially malignant disorders and subsequent oral cancer. There may be some overlap, but there are certain unique distinguishing features for oral submucous fibrosis.